Hello, and welcome to another episode of Fridays with Fawn. My name is Fawn Lopez. I'm the publisher of Modern Healthcare and Vice President of Crane Communications. Joining me today is Nina Goodheart, Medtronic SVP and President, Structural Heart and Aortic. Nina, it's so wonderful to see you, and thank you for joining us on this episode of Fridays with Fawn.
Thank you for having me. I'm honored to be here.
Thank you. So let's get started, shall we?
Perfect.
Okay. So you joined Medtronic in 2007 and have held several different senior leadership roles within its cardiovascular portfolio over the past 15 years. What would you consider your greatest accomplishments so far?
That's a great question, Fawn. Thank you. I have had this incredible opportunity to work at many of our big growth businesses at Medtronic, including bringing our new patient monitoring devices and algorithms for patients with irregular heart rhythms and patients who are at risk of a second stroke. I've also had this great opportunity to create new therapeutic categories for patients and bring in my current role new heart valve therapies to the market for patients who have not yet had access to those technologies. But if you're asking me about my greatest accomplishment or what I'm most proud of, I have to say it's really how we have showed up for physicians, for hospitals, for patients, and really for my own team during COVID. When COVID first started, and everyone, you remember this, everyone was just afraid to leave their homes. We were still sending our teams into hospitals to work with physicians, to work with patients, to make sure that patients were getting the best healthcare possible. Medtronic did a huge amount of work at that time to increase our supply of ventilators when they were needed most. And in my division, in our cardiac division, we created a public health campaign with the American Heart Association to really encourage patients with cardiac disease to go to the doctor, to go to the hospital when they were afraid to do that. And you might remember, especially in big cities like Chicago, like New York, we were seeing reports of patients dying at home of heart attacks because they were afraid to go to the hospital. And so this was encouraging them, letting them know that it was truly safe and that they should do that for their own healthcare. You know, we're a healthcare company, and our primary responsibility is to make sure that patients get access to healthcare and that physicians have the technologies that they need to treat their patients. I'd also say, Fawn, over the last 2 years, these were the most challenging years for me as a leader. I think most leaders have felt that way. Mm-hmm. With COVID, with the George Floyd murders in Minneapolis, our operational headquarters are in Minneapolis, as you know. The ongoing social and political unrest, the resurgence of COVID now around the world. We've had wildfires in Northern California where we have a large campus and a large team. I've had this opportunity, but I've led an organization really of thousands of people through all of this so that we could deliver for patients and for physicians. And I think it took an unprecedented, a thoughtful approach to make sure that people felt heard, that their well-being was prioritized, that we were flexible in the kind of support that we offered, because we were dealing with things that we had never dealt with before. And we really needed to make sure that for our employees, their physical, their emotional, their personal needs were being met. And I think it was never more important that I showed up as an empathetic leader, an authentic leader, really focused on the right things to make sure that we could come out of this and hopefully come out even a little bit stronger.
So true, right? It's the last few years have been extremely challenging for all of us. And as a former board member of the American Heart Association in Chicago, I spent 14 years, I think, on the board. Wow. And I want to thank you and Medtronic for your work with the American Heart Association during a very challenging time. So thank you.
Great partnership. Thank you.
Thank you. So one of your passion is empowering women in healthcare. Research shows that organizations with more female executives perform much better. How have you helped make this a priority at Medtronic?
So we know from all of the data, including the extensive work done by McKinsey in their women in the workplace studies, that companies that have more women executives in decision-making positions generate stronger market returns and have superior products. We have seen that, over time. We also know when more women are in leadership positions, organizations see better results, employees are more engaged. We even know in our space that patients are benefiting from improved clinical outcomes. And while we've made a ton of progress in female executive representation, even during COVID, I think we also all know that there's still a lot more work to be done. We've got to continue to place more emphasis on increasing gender diversity and, addressing the really complicated, broad issues that tend to be roadblocks for women as they advance their career.
Absolutely. So let's talk a bit about the
Yeah.
effort that you put into it. So you co-chair the Medtronic Women's Network, a global employee resource group. And in this role, you have helped Medtronic to reach its goal of 40% of women in management by the end of 2020. Would you share with us what steps did you take to help make this possible?
It has really been a privilege to co-chair the Medtronic Women's Network, and I do think that we have helped the organization achieve that 40% of women in management goal by the end of 2020, which has exceeded industry benchmarks, which has been great to see. We have had a focus on diversity, engagement, and inclusion over time. And as you've mentioned, it is a global network. Over 23,000 women and their allies, so 23,000 men and women, focused on empowerment of women in the organization across over 72 countries. So truly a global network. You've asked what we've done to get to those goals. And I think there's been a couple of things. We have a number of programs, number one, that have helped us do this. We have a program that I'm really, really proud of. It's called our LIFT program. This is a 9-month development program designed really to reduce turnover, but really to advance the brightest, the most diverse mid-level career talent that we have at Medtronic. And last year, in this program, we saw 44% of our LIFT graduates received a promotion. 75% of those were women. So a very intentional focus on bringing women up in the organization. Given that we're a technology company, we're also focused on women in science and engineering. We have a company initiative called WISE, really, again, focused on bringing women up in this underrepresented area, right? Engineering tends to be male-dominated. And so we've been providing coaching and mentorship and sponsorship to our women in STEM, so women in science, technology, and engineering, to ensure that they're moving forward in their careers. And now, as a result of that, over the last year, we have seen Medtronic now has 31% of our science and engineering roles filled by women and 28% of our technical roles, management roles, filled by women. So we're continuing to see that progress, I think, based on the focus and intentionality that we've had.
Love that you have men at the table, right? So in the network, so really so important, right? So men have to be at the table in order for us to solve or to advancing women in leadership roles. So congratulations on your success thus far. And my follow-up question to you is this. Has the pandemic impacted your effort in any way? You talked about, we still have a long way to go, but has it derailed it in any way? Or have you seen an increase in the number of female representation in management at Medtronic?
I am so pleased, Fawn, to say that we have seen an increase in women in management positions at Medtronic. And I think, again, due to the programs that we've offered, the intentionality that we've shown, and the mentorship and the sponsorship that we provided through networks like the Medtronic Women's Network for women at the organization. I also think that our employee resource groups have been hugely helpful as people have looked for connection, as they've looked for mentoring. And so I'm very, very proud to say that we're continuing to see our numbers come up when we expected them during the pandemic to come down.
That's just wonderful. Congrats there. So let's shift gear a little bit and talk a little bit about you. What keeps you up at night? And more importantly, what gets you up in the morning? What gets you motivated in the morning?
Yeah, so I'm not a great sleeper, so a lot of things keep me up at night, but probably the thing that keeps me up at night is the same thing that gets me up in the morning. When I think about Medtronic and the incredible technologies that we have the opportunity to bring to the market, the thing that I think about at 2 a.m. is, am I making the right decisions? Are we investing in the right technologies? Do we have the right people at the table to help us make those decisions? Are we leaving anything behind? And so I think a lot about how do we ensure that we're bringing the best technologies, meeting what we call that unmet clinical need. How are we bringing technologies to be able to do that? And so when I think about what gets me up in the morning, it's the ability to work with these amazing, talented scientists and engineers and clinical people and regulatory people to help us do exactly that. At Medtronic, we talk about the fact that we impact a patient life somewhere in the world with our technologies every 2 seconds. It's a pretty amazing statistic. And I think a lot about how do we make that 1 second? How do we ensure that every second of every day, somebody's life is improved by the technologies and the therapies that we're bringing to market? And it's so incredibly heartwarming when we talk to patients and they tell us about a wedding that they were able to attend because their life was impacted, or a graduation, or a baby, whatever their life circumstance might be. And so that's what keeps me awake, but it also gets me out of bed at 5 a.m. Ready to go at it again.
Thank you so much. And I will say this, and I know you feel the same way, right? That we are so lucky to be in healthcare. You have much more of a direct line to patients and saving lives than us, than me. But just being part of it, as playing a small role in it, is such a privilege, and one that I am always grateful for. So thank you for all that you do and for helping patients and saving patients and families. So,
Thank you.
so anyway, my next question to you is, if you were able to go back in time, 10 years, what would you tell yourself, your younger self, about leadership and that you didn't know then?
Well, I think there are so many things I would tell myself, but in terms of leadership, I think probably the biggest learning for me, Fawn, was that leadership is not about the leader. And I think it took me a little while to recognize that leadership is really about developing and bringing along the people on your teams. It's not about managing the work. It's not about doing the work. It's really about inspiring and setting a vision and then bringing the entire team along with you on that journey. For me, it's been about being on a journey of curiosity. I'm an avid reader. I read our clinical journals, I read newspapers, I read Crane Communications, I read Modern Healthcare, right? But it's all really about learning, and how do you bring that learning forward to your teams. And maybe lastly, it's about being authentic and transparent. We had a prior CEO at Medtronic, Bill George, he's now at Harvard, who talks a lot about authentic leadership. And about really being true to your own core purpose and your own core values, and how you bring that to the teams that you work with. And so I think a lot about how to be that authentic, empathetic leader so that we can get all of the work done that we have in front of us.
Thank you for that. So as leaders, we wear many hats, and we got our plates are full. How do you balance work and life responsibilities? And I know this is a question I'm asked all the time. So I'm going to ask you now. So what advice would you give other women who are struggling with work-life balance?
Well, you know this, right? This is the hardest question that I ever get, because I don't think there's a simple or single answer or solution. I think that every person, every woman has to figure out what works best for her, what works best for her and her family. And I don't know, and I've learned this over time, I don't know that we ever achieve balance, right? I've never found it to be 50-50. There are days it's 90% work, there are days it's 90% family, and you have to be able to, over time, to put that together. The pandemic did not make any of this any easier, right? We're all working longer hours, we're sitting on Zoom calls, we've got dogs barking in the background, we've got little children popping their heads into Zoom, which personally I love. But it's not gotten easier. And I think groups like the Medtronic Women's Network offers help and peer counseling and support for women, which has been hugely helpful. We have flexible working options now for all of our employees, which also I think makes figuring out how to balance work and life a little bit easier. But at the end of the day, I think women have to be willing and able to speak up, to tell their managers what they want and what they need to be the most productive and to be able to bring their full and whole selves to work. And they have to figure out what really is going to work for them. And I'm just glad that we have the opportunity to offer them some of the options to do that.
So you kind of answered the question that I was going to ask, but I just wanted to be more intentional about that. So from your experience with the Medtronic Women's Network, give us a couple of strategies for other women as to how they can achieve or get to prominent roles in healthcare, and for those that are aiming for healthcare leadership positions, especially in technology in STEM.
You know, I talk to a lot of women, I'm sure you do as well, as they're looking to move up in their careers. And what I tell them all the time is, don't think about the position, don't think about the title, don't think about the salary. Think about what it is that you want to do and think about the impact that you want to have. And I think that's sometimes where we all struggle. And what I've said to women is, be really clear about what your career aspirations are, and don't be afraid to ask. Ask for the experiences that are going to get you to that next level. Ask for mentorship. Ask for sponsorship, not just mentorship, which is talking about what you want to do, but ask for the sponsorship for people to help push you to that next level. And I think sometimes women are afraid to do that. And so my counsel is always think about what it is you want to do, and then don't be afraid to ask for it.
Great. If you don't ask, you don't get, right? I always said, why don't people ask more, right? I've always asked about 4 things, because you don't ask, people don't know.
That's exactly
what you want and what you need from them, right? So my last question to you is, where will we find you on a Saturday morning at 10 a.m.?
Depends what Saturday. And so my husband and I, we have a group of friends who do an enormous amount of traveling. So on any given Saturday, we could be anywhere in the world. But most of the time, Saturdays are for family. And so Saturdays are spent with my husband, with my children, because look, with everything we're doing and how busy we all are, if we can spend a little extra time at home with our family, there's nothing better.
Thank you for sharing that. Nina, it's been such a pleasure talking with you today, and it's such an honor to have you on this episode of Fridays with Fawn. Thank you for taking the time out of your very busy schedule to be with us today.
Thank you so much for having me. It's been a pleasure. I really appreciate it.
Thank you. And thank you to everyone else for joining us today. As always, I look forward to seeing you on the next episode of Fridays with Fawn. And until then, please stay well. Thank you.